Ready?
All right, we'll begin with the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the April 8, 2024 meeting of the Shawnee County Board of County Commissioners work session. This morning I'm Kevin Cook, serving as the chair, and also joining me is Commissioner Aaron Mays. Good morning. Good morning. Commissioner Bill Rippon is out looking at the sky and is making sure that things don't fall. So we also have our county councilor here with us. This morning we're going to be discussing the emergency telecommunications and getting an update. I'm turning it over to Nelson Castile. Good morning.
Morning, Commissioners. Nelson Castile, Ambulance Compliance. I'm going to briefly provide just a little background, and then I'm going to let these wonderful, dedicated folks behind me talk to you, answer any questions or anything that you'd like to have them do. So, here we go. So, in January 2022, the Commission directed us to start looking at some of the innovations in the AMR contract that we have. These innovations were of a communications nature. So on March 30th, 2022, the management of the 911 center reversed the flow as to how the calls had been handled for decades and changed it so that we could start implementing some innovations. Throughout 22 and 23, through the implementation of the resolution 2023-14, you basically directed us to form some task forces, groups, committees, engage in bettering our EMS system. Today we're going to talk mostly communications. So Shawnee County and AMR telecommunicators, they're all in the same space over there. And we have seen some excellent collaboration. We've seen excellent performance. We've seen folks that have been flexible and adaptable in there, which as the ambulance compliance officer, that really helps us out in our endeavors here to provide emergency medical service. So before I turn it over here, I don't remember if oh, there it is. I didn't put the number up because I forgot, but next week is the National Public Safety Telecommunicators Week. There'll be a resolution of approval on the Board of County Commission consent agenda next week. So I'm just going to ask, how many 911 calls nationally do you think 911 dispatchers take?
Nationally or locally?
Nationally.
Oh,
Millions,
yes.
probably.
Okay. Well, according to two websites I checked, on a yearly basis across all 50 states, including all the territories, it is 240 million 911 calls that are taken by dispatchers. Those are only 911 calls. AMR takes administrative calls that place some of the calls that they have, the runs they have into our system. The 911 center does as well. Director Rabb will be up here, and there's some stats that we can provide to you here shortly. So I'd like to welcome the dedicated team. Most of these folks are involved at some level in our task force meetings, our working groups, and our committees. I'm just going to start the list. Director Jeremy Rabb is back there. Deputy Director Melanie Roberts, Shawnee County Major Danny Lottridge, the AMR Communications Manager, Melanie Bergers, AMR Communications Lead, Bar Montgomery, Soldier Township Fire, Interim Fire Chief, there he is, Chad Lady. He had an interesting weekend like the rest of us. AMR Operations, Mickey Huber, AMR Regional Director, John Antrim, and then the AMR CES, Ann Antrim, and Jason Shawnee, who is the Interim Chief of Mission Township Fire. Did I miss anybody? You're probably going to tell me that. So, and Mary Glassbach was brought up along with with the AMR side. So I'm going to turn it over to Director Rabb if you don't have any questions yet.
Thank you, Nelson, and thank you for being here today.
Good morning, Commissioners. Jeremy Rabb, Director of Emergency Communications, Shawnee County Sheriff's Office. As Mr. Castillo alluded to, the April 14th through the 20th is National Public Safety Telecommunicators Week. It's the week that we honor the individuals that dedicate their lives to serving public safety. Last year in 2023, Shawnee County 911 fielded approximately 112,000 911 calls, along with 166,000 administrative calls that also come into the 911 center. That second number is inbound and outbound as well. So they continue to face the challenges that our nation's 911 professionals do with incoming calls, the volume increasing, technological changes, as well as the stress and the emotional roller coasters that they tend to go through during this job. So this week, or this coming week, we just ask that we recognize our individuals here in Shawnee County. They do a wonderful job, both on the 911 side, Shawnee County, as well as our EMS AMR partners as well.
Absolutely. So close to 250,000 calls come through Shawnee County Dispatch on a yearly basis?
Yes,
Okay.
yes, absolutely, 911 as well as administrative. So many times administrative calls can also turn into other type of phone calls as well.
Commissioner Mays, questions? Or?
Not yet.
Okay.
Yeah, I really appreciate all that you guys do, and I mean the dedication, and we know that calls don't come in on a scheduled basis, so a lot of them will come in on one time, and so.
Absolutely. And for the past 2 years, we've had a tremendous amount of success with the agencies that we partner with. Our city agencies as well as our rural fire and rural city or police agencies as well. We've come together collectively. We've looked at how do we better streamline Shawnee County 911? How do we get rid of antiquated procedures and processes and allow the technology that we own to really take effect, grab hold, and to help make things more efficient in our system.
Appreciate all of that.
Yeah.
Thank you.
Yeah. So if you don't have any other questions, Commissioners, I will turn it back over to Nelson.
All right, thank you.
Thank you. Roughly, there you go. There's the numbers that we looked at that are brought off of the system that we use for our annual statistics. The number in 2023 on 911 going up. You'll see a variance in there, just of course depends upon how you hold the data. This is 120,000 911 calls. We also have a large amount of abandoned 911 calls that come into the system. Sometimes they've just been misdialed. Sometimes they are done in a way that the person may not be able to speak. We also have introduced the text to 911 technology, which isn't really reflected on there. And here, there you go, you can see the calls that are transferred over to our partners at AMR so they can handle the medical side of the house.
It's a lot of calls. Commissioner Mays?
So when you're figuring out 911 versus administrative, you know, what classifies as an administrative call? I mean, I know like I have a burn permit, and every time I call, I'm surprised that it rings to 911 and not an office somewhere. I mean, is that the kind of thing that you're talking about?
Yes, that is. Shawnee County historically has fielded thousands, tens of thousands of calls that I don't feel are really within the scope of a 911 center per se. A lot of them are not emergent and oftentimes end up needing to be referred to a public utilities or another agency or entity outside to handle the business. So yes, sir, exactly what you just said there. We've recently changed the burn permit process. That's one of them that we're trying to make a little bit more efficient. So when you call, you will either go to a new automated system in the city for the city fire, which then handles it, and rural still handles burn permits, sometimes in a manner that's either on their answering machine or hopefully they'll answer it correct. But those are the type of calls that we're trying to remove from the center so that our individuals can truly answer and focus on 911 phone calls from our customer, the citizens who need help, and also maintain that communication on radios with our police and first responder partners that are in the field.
Great.
I believe we have had, if we were to do the numbers, we've probably been able to reduce our administrative call load. Again, these are calls that really aren't necessarily related to 911 or emergent issues, by approximately 85,000 calls a year right now. And we have more to do.
Right.
Yeah.
That's awesome.
Yeah, we need to focus on the citizen and make sure that none of those calls from 911 are left unanswered.
Great.
Thank you.
Thank you.
Yes. Yep.
Good morning, Commissioners. Melanie Bergers. I'm the Communications Manager for AMR in the West Region. It's been very nice to work with Shawnee County and some of the innovative things that we've done since March 30th, 2022. They've changed the way that those calls answer, and so there's been a lot of technology updates, and some of our dispatchers are here today just so we can recognize them as well. They've rolled with those changes, and we had just under 200 hours of training this last year that they completed through the EMD process. They have to do continued education hours. They've done everything from making sure that they can provide CPR to our callers, to geography training, to technology training. So they've really rolled with what those changes are to be better for our community here in Shawnee County. And it's really who we're here to celebrate today. Thank you.
Wow.
Any questions for AMR?
So when we implemented the nurse navigator system, that was a huge change in some of our operations. Are we seeing, I know that there's a learning curve to any new system, changing how things have been done. Are we starting to see an improvement? Is it something that has it been worth the investment?
You know, I will say we're just at the year mark. So what we are actually doing in-house is looking at the past year. We see about 30% of our calls each month that are navigated out of the system. But we are looking at an entire year look back. We meet with nurse navigation every single month to talk about what's coming back and why is that coming back. At the beginning of that implementation, Lyft and Uber was not available just yet. So in about 3 months in, we were able to implement Lyft and Uber so they could go and pick up those patients and get them to an urgent care or even take them to the emergency room. We do have some work to do, and those final numbers aren't in just quite yet.
Okay.
But I will say that it does free up, even with 30%, that 30% does free up some of our ambulances for more critical patients. Patients who are in their homes without medical assistance, they're not at a facility, so they can go and assist them instead of someone who really might just need to go to an urgent care. After every single call, those callers do go through a survey process, and what we're seeing is people don't know where else to call. And we're also seeing that it's a perceived emergency because maybe they spoke with their doctor that day and the doctor said, hey, you probably need to go ahead and go into the ER, but they lack the transportation to get there, so they will contact 911, which gets over to us due to it being a medical emergency, and we'll triage that call based on the emergency medical dispatch protocols. If it codes out appropriately, that nurse then takes over. Depending on what that caller says, there may be a higher acuity piece that that nurse is really able to dig into, and they'll send it back to us. So I know we are working in-house on those numbers and really looking at the cost benefit overall.
I know a big piece of the nurse navigator was getting the right resources to the right calls, and making sure that we evaluated what needs to be sent to an individual call. So
Correct.
I appreciate that.
Yep.
All right. Thank you very much.
Thank you.
Anybody else would like to speak on this? All right, we'll end it here just a little bit. Going forward, as Melanie Berger said, Nurse Nav, we had a little bit there with Lyft and Uber, so we are in the process of doing a whole year. I'd like by the end of June to have another work session with you to kind of to show you where we are with things like that. Coming up, hopefully before I go on vacation in May, we will have the final for the year 2023 that I can present to you. Right now, we're waiting on the audited financials to get here. They're not due till May 1st, so we want to make sure to include that in there. You will continue to get the memos and the brief outs on all the task forces, groups, and committees that we have going. Couple folks aren't here tonight, but I will relate, due to your approval in 2023 of the Crew Force app and the Fire Mobile app, we sent a large number of resources out to a large fire over the weekend. It was up near Blue Rapids, and those people that had their cell phones or iPads or Fire Mobile, we were able to see where they were on the map. We even helped one of them that got just a little bit lost up there. They went right at Frankfurt instead of left, and we could see just where it was that they went. So very exciting time for us to be working on some of our technology. We're going to be working on the on some of the tiered response ideas that have come up, and we've been working with Dr. Thompson and Ann Antrim on a number of these things that we want to get those calls that, as Commissioner Cook said, the right resource to the right place. I will say through the compliance, I can see in some of the months where a Nurse Nav came in and it saved a late or it didn't crash the system. So I'd be happy to stand for any questions you might have, or if you have any questions for any of these fine folks behind me.
You know, we have a couple of our dispatcher here. Do you have any insight on what makes a good telecommunications emergency worker? If you have a person who's looking at a career in emergency telecommunications, what would be some of the things you could say to them about that would make them a good candidate? Because we are always looking for good candidates in emergency telecommunications.
Barbara Montgomery, lead dispatch. I'd say someone who's compassionate, someone who's able to work quickly, but be able to think quickly as well while they're working quickly. Someone who can work the hours and deal with the stress of the calls, the highs and lows.
I just know that when we have gone to dispatch before, it's always amazing. There's 4 or 5 screens open or monitors going at one time. It takes a lot of ability to multitask and make sure that you can look at a lot of different things at once and be able to communicate and type and monitor everything at one time. And so it's always very amazing to watch dispatch in action.
Yeah. That room is really amazing. When it gets tough in there, we all work together, and it's just a seamless process. It's really amazing to watch this teamwork, the teamwork between AMR and Shawnee County.
That's great.
Yeah. Thank you very much.
Thank you.
Anybody else? All right. Commissioners, any further questions?
Should we talk about capital improvement plan stuff at all, or?
We
I mean, I know
Can,
that-
yeah.
We can. Director Rabb and myself, we might actually have something to update.
Okay, yeah. Jeremy Rabb, Shawnee County Emergency Communications, Sheriff's Office Director. I assume that you might be referring to the funds that we have on the ARPA schedule for the remodels that we have.
There were a few items. I believe we were looking at new desks and then some center upgrades, and Just,
Yes.
I mean, I think we had 3 or 4 different items that that you guys were requesting at one time, so.
We do. There's a lot of technological upgrades wrapped up in that as well for the 911 center, but primarily was the main 911 center at the LEC. We were looking at the time at doing a remodel, expansion of some space so we can better facilitate and house all of the partners in there because we're short on space, as well as the consoles are now 15 years old. There's no repair parts for them. So with that money, we started moving forward, developing our plan. We had some construction in place as well as a lot of rewiring and some other work. Developments over the past several months really made us put a halt on moving forward with any construction or anything of that nature. So we were in a pause for a while, and now we feel that we're ready to just at least move forward with pursuing new consoles and some basic redo work of the main center. So we're actively getting bids for those right now throughout the center. Throughout the center, there will be some technological advancements as well that we need to put into the radio system and what we have called a core to allow the consoles to talk better throughout the system amongst all of our partners. So the main 911 center is currently being looked at, as well as our backup center that we have. We're going to be doing the same. It's a very small space, but the space that we do have, we're fortunate to have, and we need to make that to where it can actually better replicate a current 911 center that we have and give the tools to our future trainees who also might train there, and as well as if we need to go into a backup scenario, we can effectively operate there for long term. So that's in the works as well. Bids.
So bluntly, if the Shawnee County does purchase Harley-Davidson location at 21st and Topeka Boulevard, it's anticipated that we would not actually be occupying that space for potentially a year after purchase. And so that's going to put you out into 2025, 2026 for occupancy. Is the equipment that you're purchasing now going to be able to be moved over to that new location if we do make that move?
Yes, it is. The equipment that we would be pursuing, whether it's going to go into the radio system to facilitate the technological piece, that would remain there, as well as consoles and those other updates, they would be able to be moved, retrofitted to a new space if we were to ever get that space, yes.
Okay. And I know until it's done, it's not done, and this is a project that we are midstream on, and we've not finalized any purchase yet. So I appreciate you saying we need to look at all of our different contingencies.
Absolutely, yes.
Commissioners, I might remind you that our due diligence date ends next week.
Okay.
So a decision should be one way or the other on the agenda for the 18th.
Okay. So stay tuned, I guess.
Staying tuned.
Commissioner Mason, questions or?
How explain to me some of the logistics of if we're gonna have like contractors coming in and assembling things and hooking stuff up, are they security vetted, like I mean, obviously the 911 center is a pretty secure location, but I mean,
Yes.
you just have contractors coming and going all day. I think does it mess up the flow of everything going on in there on a daily basis?
Well, let's see, there's a couple answers here for you, Commissioner. Yes, contractors would be vetted and have backgrounds done on them. Now, by and large, most of them have already gone through that process. Several local vendors here who have already done work for the county throughout have probably already been vetted, would get another vetting as well if need be. And the organizations or companies that tend to do this type of work, it's normal for them to already have a law enforcement background investigation done. Because
Okay.
they have access in and out to facilities throughout the state or even the nation. So rest assured, yeah, they will be vetted and we won't have anybody in there that shouldn't be in there.
Okay.
As far as a process goes, yes, it's important that we get, if we move forward, we get everything taken care of in our backup center and make that fully functional and operational. So all of our individuals, our county 911 as well as AMR 911 can then go to the backup center, remain operational there, freeing up the main center for the rework and the new consoles be installed.
Great, okay, thank you.
Both pre and post-COVID, staffing with dispatch has been an issue. At one point, we were at a critical level, and I know that we've done a lot of different initiatives, including incentives and working with Washburn Tech. How do we stand now with our dispatch employment?
Today, we are at roughly 25 full-time, 2 part-time. There's 1 in training right now, and then we have our 3 administrative positions. So the manpower for the 911 has remained relatively balanced. We haven't had a big exodus of individuals. There's a lot that goes into providing an environment that really makes them to where they can handle the job, do the job, and make it attainable for them. We've got to give them the right type of environment where they can handle the incoming calls, talk on their radio, and really allow them to be able to do their job efficiently without causing any undue stress. They're always under stress. So I think one of the biggest things that we can do to help maintain our manpower is to just continue to work on that environment and bring in the technology and help streamline their jobs to where they can feel and they can be successful at it.
Okay, I appreciate that. Thank you.
Yes.
Anything else? Oh,
Nothing else
all
for
right.
me.
Thank you.
Okay.
Thank you.
Thank you, Commissioners.
Melanie, did you want to talk to me about AMR staff or anything like that? I'm going to ask Melanie Burgers to come up as part of our contract with AMR. That was a part of NurseNav. We were going to pay them to provide a 3rd dispatcher. That program works fantastic, but they've got some folks on leave, and I'm going to let Melanie explain that just briefly.
Commissioners, we are currently fully staffed with 4 in training. We have 2 dispatchers that are actually here, 1 from Seattle and 1 from Sacramento, that we brought in due to a couple of our folks leaving with pregnancies a little sooner than we'd hoped. So we brought them in, which was a very interesting process. They took a couple days to train because they utilize the same systems that we do. Those are utilized across the nation by AMR and other comm centers. So that's been very interesting to have them here. By May 1st, we should have our 2 10-to-10 dispatchers in place. The 4 dispatchers that we have in training, we just held an orientation for. We do a classroom environment training for them for a week. They were finished up and passed their certification exams to take the medical calls just last week. So they're taking live 911 calls at this point. So then that timeline matches up. By May 1st, we should have the 3rd in place at that point.
Okay.
Great.
Very good.
Yeah.
Thank you.
Right, in closing, I'll just say that everybody in this room that helps us with EMS communications is one of our most vital resources that we have. So next month, I believe it's the 3rd week in May, is the National EMS Week, and we will be back to provide some information on that as to how things are going with EMS. Our EMS system does include our hospitals, our first responders, our ambulance people, all those folks that we couldn't do without. It's an evolving process, and I think we've made some excellent success here in the last probably 24, 25 months. So this is the last slide, but I'd like to thank everybody here. I wish everybody a happy Telecommunications Week. And if any of you ever want to experience the fun over there and relax, I'm sure that Director Rabb will let you come in and put a headset on, or Melanie, there she is, or Melanie may even do that as well. It's amazing what technology has done. So,
Just a lot of training, and I appreciate all of the training that goes into it. And so when you talk about 200 hours of training, it's not an easy task. So thank you.
thank you, Commissioners. Thank you, everybody.
Well, our next item is public comment. I don't know if we have anybody from the public that wishes to Have any comment? Any administrative communications?
Not from me.
No?
Looks like there
Nope.
might be one from Dusty, though.
Yeah.
Morning, Commissioners, Dustin Nichols, Emergency Management. On Saturday afternoon, we got a request from the state to support some fires going on in Blue Rapids. I just want to say thank you to all the Shawnee County fire districts that supported that. It was six or seven fire departments, a little over 24 personnel deployed over the next few hours to help with that fire. Everybody returned. They took about a dozen pieces of apparatus. As far as I know, everything returned in good health and good shape. So thanks to the communicators, since they're here, for helping that along, especially the dispatch, and then of course Nelson was our duty officer for that piece. So thank you to those firefighters and all those who deployed. I know Chad's here too. Good job. So if you have any questions or more detailed report can be in your inbox here soon.
Well, let's answer the question I've been asked 5 times already this morning. What's the smell outside? Is that the forestry, or is that Maple Hill, or?
I think it's Chad Lady's entrance. He just smells like it's just in the air. I mean, there's fires. We do have fire weather, so we still need people to pay attention to what they're burning, because those things can get out of control, especially when the wind keeps up. So they're just fires around the area.
Okay.
As far as I know, there's no big fire, because if there was, some of these people wouldn't be in here. So I would just say it's probably just general fires in the area. But please be careful when you're burning.
It's a good reminder to be careful.
So, thanks.
Thank you. Anything else? I don't have anything else, so we're adjourned until Thursday.